Joe Dunham decides it is time to see the doctor for the wound on his left foot that is not healing and very uncomfortable. After finishing his last cigarette, the 59-year-old walks from the parking garage to the emergency department. Joe spends about 15 minutes in the waiting room before the nurse calls his name and checks his vital signs. Joe is febrile and has high blood pressure, but his heart rate and oxygen levels are normal. The nurse escorts Joe into the exam room where he waits for Dr. Banks. Dr. Banks reviews Joe's electronic medical records. He enters the exam room where Joe is sitting.
Hello, Mr. Dunham?
Yes.
My name's Dr. Banks. Nice to meet you.
Hey, Doc, Joe.
Tell me what brings you in to see us today.
Well, Doc, it started with a small cut on my left foot, and I believe I had a rock in my shoe. I couldn't really feel it to tell. It's taken a long time to heal, so I'm kind of worried about that.
Well, I definitely want to take a look at your wound a little bit later, but why don't you tell me about your medical history first?
Well, a couple of things going on. I have diabetes, I have high blood pressure, and some peripheral vascular issues.
Okay. Do you smoke?
I do.
Okay. What medications do you take?
I take a sugar pill, or I used to, and I haven't really done that in a while.
Okay. Well, let's take a look at your wound now then.
Dr. Banks carefully examines the wound on Joe's heel, which appears deep and measures 3 centimeters by 2 centimeters on the skin surface. He notes that there is a copious, foul-smelling yellowish drainage from the wound.
Well, Mr. Dunham, I'm concerned about the appearance of your wound. So if it's okay with you, I'd like to get some blood work, I'd like to get an x-ray of your heel, and I'd like to get a wound culture. I'm also going to ask our orthopedic surgery team to come take a look at your wound as well, if that's all right with you.
Sure, Doc, whatever it takes.
Joe's lab results come back. He has a hemoglobin A1C level of 9.6 and white blood cell count of 22,000. The differential demonstrates 93% neutrophils. The orthopedic surgeon probes the heel bone through the wound, which means that it is possible for bacteria to have also entered the wound and caused an infection. X-ray results suggest that Joe has osteomyelitis. A Gram stain reveals clusters of Gram-positive cocci, suggesting the presence of Staphylococcus aureus bacteria.
Hey, Mr. Dunham. Dr. Banks again. Test results are back in. Well, Mr. Dunham, I'm concerned about your heel infection. Your body is mounting an inflammatory response against it, but I just don't think it's going to be enough. So if it's all right with you, I'd like to admit you to the hospital for closer monitoring, and so we can give you some stronger medicines, and more specifically, intravenous antibiotics.
Man, Doc, that's not what I wanted to hear, but let's get on with it.
Joe is admitted to the hospital. He remains in the hospital for 2 weeks and receives several IV antibiotics, but the wound only worsens and progresses up his leg. A team including Dr. Bank checks in with Joe on a daily basis. While Dr. Bank often provides Joe encouragement, he must also break the bad news.
Well, Mr. Dunham, I'm sorry to say this, but your heel bone infection doesn't seem to be improving, and actually it seems to be getting worse. I'm afraid if we don't start talking about more aggressive measures, that you could become much sicker. So I think it's time that we start talking about amputation, and more specifically, a mid-thigh amputation.
Oh, Doc, man. I don't want to hear that. But if you and the team think that's something we got to consider, then okay.
I know this is difficult to hear, and I can understand your frustration. I think anyone in a similar situation would be equally as frustrated. My concern being that if we don't do anything soon, the infection could spread from the heel bone into the bloodstream and can cause something called sepsis, which sometimes can be fatal.
Well, then let's get on with it, Doc.
2 months after the surgery, Joe is functioning independently in a wheelchair. He is now ready to follow up with a rehabilitation medicine doctor. His clinical vital signs show a normal temperature, blood pressure, heart rate, and oxygen levels. He feels much better, but is now having a lot of pain on the amputated side where his foot previously was located. He He has been meeting with his primary care doctor to establish a regimen for taking medicine to control his blood pressure and diabetes. The wound has healed and the surgical staples have been removed by the orthopedic surgeon.
Hi Joe, I'm Dr. Klein. I'm a rehabilitation doctor.
Hey, Dr. Klein.
How have you been feeling?
Well, I'm better. I'm getting some medication from my primary care for diabetes and my blood pressure. So I think that's better and more under control. But I tell you, Doc, I'm getting some pain, severe pain in my leg where I don't have a leg.
Can you tell me a little bit more about that? When you feel it, what exactly it feels like?
Well, it's intermittent, but it's severe at times, and it can be a stabbing pain. It can be sort of a buzzing pain too, you know. But there are times when it hits you strong, it'll actually take the vision away. It's that strong.
I think that we can give you a prescription medication that will help take some of that pain away and kind of let you do a little bit more. Tell me, how have you been getting around lately since your amputation?
Right. Well, I'm better, but I'm ambulating. I'm in a wheelchair, and it's easy to get to the shower now. I can pull myself up. It's that part of it's getting better.
So now that your wound is healed so well, it's time for you to be fit for a prosthetic leg. So I'm going to have you meet with one of our physical therapists who's going to help me determine which leg would be most appropriate for you to get you back to doing what you want to do.
Well, I'm ready to get going because I've got family I want to see. I want to get back to work. I was always an active person, so great.
A physical therapist assesses Joe in the gym. Joe's strength, balance, and endurance are sufficient for Joe to receive a prosthesis. The physical therapist and Dr. Klein discuss which type of prosthesis would be most appropriate. Dr. Klein then informs Joe of their decision.
Joe, I'm going to go ahead and write you a prescription for your above-the-knee prosthesis. It's going to be suction seal with a microprocessor knee, which I think will work really well for you. Also going to go ahead and write a prescription for the medicine that will help with that pain that you're experiencing, the phantom limb pain. And then once you get your prosthesis, it's important that you will work with our physical therapist, and they'll be able to help you learn how to use that prosthesis and walk better.
Doc, all that's just great news. I'm ready to get going.
Joe visits Dr. Klein again after undergoing physical therapy and now walking on his new prosthesis. He is making good progress in ambulation, but still feels considerable persistent pain in his amputated leg despite his treatment plan. During Joe's next appointment with Dr. Klein, he asks for alternative treatments.
This pain sounds really difficult.
Doc, it's really bad. I tell you, we got to try something new.
There is a physician I know in the area who is using virtual reality.
Wow, I mean, VR for pain management, I don't think I've ever heard of that.
Yeah, so like you said, sometimes it is referred to as VR, and it's just another way to help patients who have had amputations deal with their pain symptoms. What they do is give you a headset, and then they immerse you in a virtual reality environment in hopes of kind of lessening the amount of pain that you're feeling. I can be happy to give you a business card of a physician I know in the area who is doing virtual reality.
Well, absolutely. Anything that would stop this pain and without the meds, so much of the meds. So I'd like to try. I'd like to hear about it.
Sure. Here's this physician's information on his business card.
Joe contacts the physician and starts the virtual reality therapy. He has a return visit in the rehabilitation clinic with Dr. Klein 3 months later.
Hey Joe, it's nice to see you again. How is your pain since I last saw you?
Well, Doc, it's better. The VR treatment seems to have helped. I'm guessing I'm about 50% better, actually.
That's great to hear. That's
Yeah.
absolutely wonderful. How's everything else been going? Walking, transfers?
That, too, has improved. With the prosthetic leg, I'm getting better at it every day. With my family, my work, I've traveled a little bit now. So I'm actually doing pretty good.
Perfect. Sounds like you're doing really well. You're progressing kind of as we expected. I do want to see you about every 2 to 3 months or so just to keep an eye on things, evaluate you from the rehabilitation perspective to make sure that we're doing what we can to help you. So we'll keep doing that, and then I'll also have you see your primary care doctor in order to manage any risk factors that you might have. Because what we don't want to do is for you to develop any sort of other skin wound at this time. So we'll take the team approach and we'll have you keep following up with us.
Right. Well, that all sounds reasonable, and I'm for it. I like my team, by the way, so I'm ready for it.